Hello and welcome to our video on why is health insurance important. Health insurance is a critical component of your overall financial plan and can provide you with access to quality healthcare when you need it the most. In this video, we will discuss the importance of health insurance and how it can benefit you and your family. What is health insurance? Health insurance is a type of insurance that covers the cost of medical and surgical expenses. Health insurance policies vary in terms of coverage and cost, and can be provided by employers, government programs, or purchased individually. Access to health care. One of the primary benefits of health insurance is access to health care. Health insurance can help to cover the cost of doctor visits, hospital stays, prescription medications, and other medical expenses. Without health insurance, these expenses can be prohibitively expensive, making it difficult to access the care you need. Financial protection. Health insurance can also provide financial protection in the event of a medical emergency. Medical bills can quickly add up, and without insurance, the cost of healthcare can be a significant burden on your finances. Health insurance can help to protect you from the financial impact of unexpected medical expenses. Preventive care. Health insurance can also provide coverage for preventive care, such as annual checkups, vaccinations, and screenings. Preventive care can help to detect medical issues early, when they are easier and less expensive to treat. By providing coverage for preventive care, health insurance can help to promote overall health and well-being. Mental health coverage. Health insurance can also provide coverage for mental health services, such as therapy and counseling. Mental health is an important component of overall health, and access to mental health services can help to improve your quality of life and well-being. Chronic condition management. If you have a chronic condition, such as diabetes or heart disease, health insurance can provide coverage for ongoing medical care and treatment. Management of chronic conditions can be expensive, and health insurance can help to ensure that you have access to the care you need to manage your condition effectively. Employer-sponsored health insurance. Many employers offer health insurance as part of their benefits package. Employer-sponsored health insurance can be a cost-effective way to obtain coverage, as the employer often pays a portion of the premium. Employer-sponsored health insurance can also provide access to a wider network of healthcare providers. Government-sponsored health insurance. Government-sponsored health insurance programs, such as Medicare and Medicaid, provide coverage for eligible individuals who meet certain criteria. These programs can be a valuable resource for individuals who may not have access to other types of health insurance. Individual health insurance. Individual health insurance policies can be purchased directly from insurance companies or through the health insurance marketplace. Individual health insurance policies can provide coverage for individuals and families who do not have access to employer-sponsored or government-sponsored health insurance. Health insurance and pre-existing conditions. Prior to the passage of the Affordable Care Act, ACA, in 2010, individuals with pre-existing conditions often had difficulty obtaining health insurance coverage. The ACA includes provisions that require insurance companies to cover individuals with pre-existing conditions and prohibit discrimination based on health status. This has made it easier for individuals with pre-existing conditions to obtain health insurance coverage. Health insurance and out-of-pocket costs. While health insurance can provide financial protection, it's important to understand that many policies come with out-of-pocket costs such as deductibles, co-pays, and co-insurance. These costs can vary depending on the policy and the specific services received. It's important to understand your policy's out-of-pocket costs and budget accordingly. Health insurance and network providers. Many health insurance policies require individuals to use network providers, which are healthcare providers that have contracts with the insurance company. Using network providers can often result in lower out-of-pocket costs. If you have a preferred healthcare provider, it's important to check if they are in-network before selecting a health insurance policy. Health insurance and preventive care. Preventive care is an important component of overall health and well-being, and many health insurance policies provide coverage for preventive services such as annual checkups, vaccinations, and screenings. By providing coverage for preventive care, health insurance can help to detect medical issues early when they are easier and less expensive to treat. Health insurance and mental health services. Mental health is an important component of overall health, and many health insurance policies provide coverage for mental health services such as therapy and counseling. It's important to check your policy's mental health coverage, as some policies may have limitations or require pre-authorization for services. Health insurance and prescription medications. Many health insurance policies provide coverage for prescription medications, which can be a significant expense for individuals with chronic conditions. It's important to check your policy's prescription drug coverage, including any limitations or requirements for prior authorization. Choosing a health insurance policy. When choosing a health insurance policy, it's important to consider your specific needs and financial situation. Factors to consider include the cost of premiums, out-of-pocket costs, network providers, and coverage for preventive care, mental health services, and prescription medications. It's also important to understand any limitations or exclusions in the policy. Health insurance and emergency care. Health insurance can also provide coverage for emergency care, which can be vital in the event of a serious illness or injury. Emergency care can be expensive, and health insurance can help to ensure that you have access to the care you need without facing significant financial burden. Health insurance and maternity care. If you are planning to have a baby, it's important to understand your health insurance coverage for maternity care. Many health insurance policies provide coverage for prenatal care, childbirth, and postpartum care. It's important to understand any limitations or exclusions in your policy, as well as any out-of-pocket costs you may incur. Health insurance and vision and dental care. While many health insurance policies provide coverage for medical care, they may not provide coverage for vision and dental care. Some policies offer separate vision and dental plans, while others may offer limited coverage for these services. It's important to understand your policy's coverage for vision and dental care, and to consider purchasing separate plans if necessary. Health insurance and long-term care. Long-term care is a type of care that is often needed as individuals age or experience disabilities. Health insurance policies typically do not provide coverage for long-term care, but separate long-term care insurance policies are available. It's important to consider long-term care insurance as part of your overall financial plan. Health insurance and open enrollment. Open enrollment is a period of time each year during which individuals can enroll in or make changes to their health insurance coverage. It's important to understand when open enrollment occurs and to take advantage of this period to ensure that you have the coverage you need. Health insurance and life changes. Life changes such as marriage, divorce, the birth of a child, or a change in employment can also impact your health insurance coverage. It's important to understand how these changes may affect your coverage and to make any necessary updates to your policy. In conclusion, health insurance is an important financial product that can provide access to quality healthcare, financial protection, and coverage for preventive care, mental health services, and chronic condition management. When choosing a health insurance policy, it's important to consider your specific needs and financial situation, as well as any limitations or exclusions in the policy. It's also important to understand your coverage for emergency care, maternity care, vision and dental care, and long-term care. Thank you for watching.